you can reach out to either one of the presenters if you need any assistance. Their information will be present in the slides as well. So you will receive their presentations and their info, their details are in there as well. Just to let you know, this webinar is also being recorded. So make sure if you don't want people to hear your voice that you post your questions in the chat box. And if you miss out on a few minutes, then of course it's no problem. You can listen back to the recording as well in the end. So that's about the webinar guidelines for today. Regarding the program, first we're gonna listen to the presentation of Ian Travers himself. He has written a guideline to return to work safely. After that, we're gonna have some time for some questions and answers. And thereafter, we're gonna listen to Geert van Lopik, a colleague of mine from CGE Risk. And he's gonna provide some guidance and tools in accordance with that guideline from Ian to help you get back to work safely. Of course, after that, also some time for questions and answers. As a short introduction to the presenters of today, I would like to invite them to introduce themselves. So Ian, could you tell something about yourself briefly?
Okay, briefly. So my name is Ian Travers. I'm based in the UK. I was a former senior regulator with the UK Health and Safety Executive. I've now spent 47 years working in health and safety. My specialist subject, if you like, with HSE was chemicals and major hazards, but since retiring in 2015, I've been working around the world, helping people generally with risk and occupational health and safety risk, as well as process safety risk. I work with organizations like the World Bank and the OECD, and my work with the OECD in Northern Italy got me involved in what does a safe return to work look like. So that's the origin of the things I'm going to share with you today. Thank you.
Okay, that sounds great. I'm really curious on what your presentation will be like, so looking forward to it. Geert, could you give a short introduction about yourself as well?
Yes, hello everybody. Thank you, Elise. I'm Geert van Lopik. I'm based in today rainy Netherlands, and I have joined CGE Risk around 5 years ago as a global account manager. But in my previous careers, I was involved in the aviation industry as a human factor specialist and a training specialist for CRM. And since joining CGE, I've been focusing on the methods and tools and how to best apply them, not just to aviation industry, but to all industries that CGE currently offers their tools to. And in that role, I often travel the world and see different industries and look in their kitchens, their very clean or not so clean kitchens, and see how they apply our methods and tools and how they successfully implement them. And this unique view helps me to actually give better advice to any other clients, whether they're in different industries. I have some insight from aviation or oil and gas or mining. All these industries have their good ways. And that's how I try to improve where I can. Recently, of course, I was browsing LinkedIn when an old friend, Ian Travers, was posting something that was, for me, very interesting to see and read, which was his guidance. While reading the guidance, I only read all these barriers and activities and these behavioral issues. And it inspired me to activate our team here in the Netherlands, with whom we have been creating a lot of work around the guidance that Ian has provided. And I'll be showing today a little bit more about that.
Okay.
So, thank you.
Thank you, Geert. It sounds also really interesting. I'm curious to see how this all comes together. Of course, in the background, I know exactly what's going to happen. And I hope for all attendees that it will be relevant for you, but I'm sure it will. So let's get to it. I think Ian is going to present first. So let me make you the presenter, and then you can share your screen with us. There you go.
Okay, thank you very much. I hope everyone can see that. It takes a little while to come onto presentation mode.
Yes, we can see it.
So let's get going. And I'm starting with the problem, and then I'm going to work through some issues. Not many people in my working career and businesses that I've been involved with or regulated get to work with pathogens. There's only a few. So obviously research laboratories, and we had the big foot and mouth outbreak here caused by a laboratory leak in the UK and various other things. And maybe people who work in mortuaries and abattoirs and with animal waste, they get to work with pathogens every day. But guess what? It's our life now. We get to work with harmful biological agents that could cause serious illness or indeed cause death. So working with pathogens has become our way of life, unlike a previous form of work. So as we get back to work and start opening up our businesses and society, we need to get used to what having a uncontrolled pathogen, unseen pathogen in our midst feels like, and how we can best protect ourselves. So it's really an unseen threat, and unlike other traditional occupational health and safety issues, the harm comes from the work activity, from noise, dust, fumes, dangerous machinery, dangerous chemicals, and workers are exposed to those forms of harm. Whereas with COVID-19, the harm comes from us. So workers exposed to other workers can cause harm, and members of the public or visitors exposed to workers can cause harm, and the other way around as well. So this is a multi-channel process for causing harm. There's still an awful lot of uncertainty about how big a risk it is and how effective the controls are. And I've had lots of questions, and they basically come something like, is it safe for me to go back to work? Well, safety is a relative thing, of course. There's no such thing as absolute safety. There's risk about every part of our life, traveling to work, working, socializing, driving a vehicle, etc., flying by airplane. So as you guys will know, in the risk business, there's no such thing as safe, but is it safe enough? And there's issues about the effectiveness of the control measures that are available. And there are issues around the way those measures have to be implemented and maintained. And a lot of those control measures depend on us as people, whether we're employees, whether we're visitors to workplaces, whether we are the members of the public going to shops, or even generally in society, based on our behavior and our good behavior in terms of protecting others from the spread of this infection. Less so, but equally, our own behavior protecting ourselves from contracting the virus. And there's a lot of confusion between those two routes within the workplace. And unfortunately, at the moment, there's no silver bullet, there's no magic answer, there's no guarantee that do this and you will be protected. So we're all in an elevated status of risk. And the measures that need to be put in place, which I'll talk through, need to be tailored exactly to the workplace. So I always say that hazards are generic and risks are always context-based. So you take the measures based on the context in which the hazard or the forms of harm can occur, and they will differ in every form of workplace. And as I explained later, the UK government has issued guidelines for 8 different types of business so far, and there's more on the way. The other thing is that we've been accustomed to being fearful of this infection. So workers and employers will all be very anxious. So mental health issues are important. and also reassurance and honesty in terms of the effectiveness control measures will be important. And employers, I know, are anxious that the regulators will come and close them down or issue high penalties, because we've seen high penalties issued as part of the lockdown in all sorts of social activities. So they're very anxious about what the regulator might do to them, and if they've made a slight error or haven't fully complied with the guidance. And then I've also been dealing recently with the legal profession about civil liability. What is the liability of an employer towards their employees, where the harm can be quite severe? In fact, we've had a couple of issues here in the UK with workers dying and it being related to their work activity, and what is the legal position over that. So these are the real challenges, and I wouldn't underestimate any of these in terms of the difficulty faced. So as I said in my introduction, I got involved in this issue because I was working with the OECD in northern Italy, where this thing hit hardest first. And so I got to help draft and put together the guidelines to help Italy come out of its lockdown. These were developed before the European guidelines came out. They were developed before the UK Health and Safety Executive Guidelines, or even the OSHA guidelines in the US. And they're in two parts of the guidelines. I have to say they're freely available. If you go to the website shown on the screen there, and we can give it you later as resource, you can download these for free. So it's about risk management, risks to control the virus in the workplace are not going to sort themselves out. Somebody has to do it, somebody has to make a risk assessment, etc., etc. Somebody has to be responsible, somebody has to monitor and take action. And then there are the control measures, and there's only a limited choice. And they're listed on the screen here, and I will go through them in turn. So there's a short menu, 7 options of things you can do in the workplace, not much else, and it's how you apply those and how importantly you sustain them that will provide levels of protection that people require in their workplace. So starting with the management arrangements, hopefully nothing new here, just the focus is different. Somebody has to assess the risk. Now that's a challenge because many people are not familiar with this form of harm, not familiar with working with pathogens, not familiar with all the science, not familiar with all the epidemiology, etc., about the risks. But there's a lot of good guidance out there, not just mine, to help people do that. Then, before going back to work, there needs to be a lot of planning. What's going to be done? Where's it going to be done? How is it going to be done? And what are the features of those control measures when they're in place? And then next part, allocate responsibility. Somebody's got to be responsible for putting these things in place. Somebody's got to be responsible for training employees, informing customers, monitoring and checking that these things are in place. They've got to be put in place. There's got to be communication and training about the reason, because this is a behavioral safety program we're going into, not a physical protection program. So you've got to get people on side understanding the reasons why you've got to, if you're going to wear a face mask, you've got to wear it over your nose and mouth. We have a local wholesalers here called Costco. They're American. I went with my wife a week or so ago to buy some goods there, and all the workers had face masks on, but they only had them over their mouth. So they were wearing face masks, but they were absolutely performing zero function because they weren't protecting their noses. And I'll talk about face masks in a minute, but I did write to Costco, and the next time I went back in, thankfully, everyone had their face masks over their whole face. None of this is going to be perfect, so somebody's going to have to sit down and think, is it working? Where are the problems occurring? What can we do to make it better? So this isn't a one-off thing. This is going to be with us for the next 9, 12, 18 months or so. So assessing the risk involves really 2 important questions. And this is about people. Where can people come into direct or close contact with others, or touch potentially contaminated surfaces and equipment? So where in your workplace, in the workplace context, And what tasks and jobs do we do that give rise to an opportunity for transmission? We know how this virus is transmitted through droplets in the air or from touching contaminated surfaces. So workflow analysis is where you should start with a workplace plan to go through what are the routes, where do people sit, where do they congregate, how do they get in and out, how do they get up and down, where do they have lunch, where do they go in the event of an emergency, where do they go and take a cigarette or a vape, etc., etc. Identify all of those points in the workplace, and then you can start planning which control measures you've got. And this is my take on what's available in terms of the control measures. And there is a kind of hierarchy in this. So the truth of the matter is you cannot contract COVID-19 from me by listening to this webinar. Okay, so I'm having no personal contact with you. You're absolutely safe from me, even if I was contagious. And that is the only certain way of preventing infection. And that's what lockdown was about, to keep people at home, away from each other, to contain the spread of infection. Then the second tier, health surveillance, social distancing, personal hygiene, and workplace cleaning, all are the kind of first line protections for the majority of employees and work activities. Less effective, and I'll explain why, is PPE in the general workplace. And then the fourth tier, but not unimportant, but effectiveness is not as great as the others, is keeping the workplace well ventilated. So I'm going to go through those briefly with you. They're all in the guidelines. The guidelines set down what this measure does, why it's needed, where it should be applied, who should apply it, and what it achieves. Because understanding its achievements and its effectiveness in terms of the threats that we have is so crucial. So avoid personal contact. Work at home still, if possible, because it's the safest option. Even if you know your society is opened up, if you're going to go back to work and employees are going to bring back to work, who are the frontline essential people? So yesterday I was talking to one of my clients, not in COVID, but in safety, and they're bringing a third of their workers back into work from next week. And they're going to see how that goes for 3 weeks and then ramp up, which is entirely a good thing to do. They have a 14-story office block and they're only going to occupy the first 5 floors, so people don't have problems getting in the lift, etc. You have to identify who are the most vulnerable in your employees in terms of the consequence of contracting COVID-19, and there's good guidance around, and I haven't got time to go through it, about susceptible people in terms of age, underlying morbidity, etc., etc. And if you've got people working at home or even furloughed, laid off, then you should stay in touch with them. Stay in touch with them and talk to them like you would as if they were in work. Keep them informed of what's going on, because social isolation and mental health is a big issue here. And then, as I said just now, don't bring everyone back at once. Ramp up to check your protection measures are working and are sustainable. Health surveillance. Now, this is the gatekeeper to infection. And unfortunately, if somebody's infected, they can be transmitting the infection for 2-3 days before they show sign of symptoms, or indeed they may not show any signs or symptoms at all. So a pre-return to work health check and declaration is vital. 2 weeks or a week before people come back, get them to fill in the declaration that they've not had symptoms, that nobody in their household has had symptoms, they've not tested positive, and nobody in their household has tested positive, and then get them to reconfirm that at the start of their work. And then repeat that often, weekly, maybe every 2 weeks, once people are back at work. Keep doing that survey. Nobody's got symptoms, nobody in your household is ill, nobody in your household has tested positive. That has to be a repeat, ongoing thing. Workplace testing for high-risk staff. So these are staff that are higher risk of contracting coronavirus at work, not vulnerable staff in terms of their effects, because they should be at home. So these are generally people in the medical or caring profession, where you've got people dealing with known or suspected cases of coronavirus, or also you might have very public-facing employees who deal with a lot of members of the public. Frequently, it's worth thinking about having routine tests for them. And then have a very good system, and there's a lot of guidance out there, and there's a section in my guidelines. What if somebody takes ill in work? What do you do? How do you handle them? Well, unlike other illnesses, you don't everyone rush to them, okay? You want a carefully developed plan about who's going to attend them, and they should stay where they are until somebody can get to them in protective clothing and guide them into a place of safety, and then get the health response. And do health declarations for your visitors and your contractors as well, just as you would do for your own staff. The next most effective method to protect yourselves and your workers is social distancing. And I'm sticking with 2 meters. And I know people have got 1.5 meters, or in France for restaurants, they've gone down to 1 meter. The science seems to point that 2 meters is a safe distance, or a relatively safe distance. And I heard a presentation by an old colleague of mine at the Health and Safety Laboratory, or Health and Safety Executive Science Division, Dr. Andrew Curran. And he said, because they've done a lot of work on respiratory protection, that the same risk exists if you're 2 meters away from a person who's infected for 1 hour, as if you were 1 meter away from them for 5 minutes. That's an equivalent level of risk. So at 2 meters, you're relatively safe. 1 meter, you're relatively at risk. And that's just the science, I'm afraid. So obviously, physical separation in the workplace, setting out routes, common areas, and workstations where people might congregate. Arrival and departure times, adjust those so people don't congregate, and it includes breaks. Make sure people understand personal behaviors and they stick to the separation distances. You may need to supervise hotspots for a while. Plenty of signs and information up in the workplace. Next, most important thing is personal hygiene. So this stops you picking up the virus. So frequent hand washing and sanitation. You may need additional washing facilities, sanitizer dispensers, etc. in your workplace. Signs and information, guidance on good sneezing and coughing etiquette into disposable tissues or the crook of your arm. People shouldn't go around touching surfaces, doors, etc., etc. Hands in pockets is a good message to give to people. Don't share equipment, calculators, telephones, things like that. And if people wear overalls or protective clothing and work that needs washing, then it should be washed on site if at all possible, rather than taken home. Workplace cleaning, very, very important, but the focus this time is not on the general things we wash and clean in our workplaces. They're on surfaces that people touch, door handles, desks, elevator buttons, etc., etc. So a clear, different cleaning plan needs to be in place. You should go through that with your cleaning staff, and especially if they're contractors, pointing physically to where the hotspots are, how to clean them, what you expect. If you're in shared buildings with other occupants, then you need to talk to the landlord or the facility management team about who's cleaning what, how often, and this must be much more frequent than you would clean the floor. It's not at the end of the day, it's frequently throughout the day. Okay, so your cleaner should be in your workplace while you're working, not when you've gone home. And waste disposal via sealed bags. Now, the most difficult issue is PPE, and particularly around face masks and respirators. So obviously, PPE is a worn barrier. Okay, it's a worn protection measure to stop 2 things: you contracting the virus, and secondly, you spreading it. Okay, so gloves, overall, apron, visors, etc. are the common things. But face masks give very little protection to the wearer unless you've got a high protection factor respirator or face mask. So what that does, a face mask stops an infected person who may or may not have symptoms spreading the virus into the community. It doesn't give much protection for the wearer. who hasn't got COVID-19 from contracting it. So PPE face masks are not PPE, they're CPE, they're community protection equipment. And you need 90 to 95% of people in an area where there's a risk of transmission to be wearing face coverings or face masks to give that protection to the community. And obviously about information about how to wear them, face fitting, if they're high protection factors for care workers and medical staff. They should be on individual issue, disposable where possible rather than reusable. But if they are reusable, clean them in-house, don't send people home with their PPE. And then the final measure is about ventilation. So although it's the least effective, it's still important because what does it do? It dilutes airborne droplets of the virus. You want 3 air changes an hour, minimum up to 5 if possible. If you can, open the doors and the windows if it does compromise security and fire protection. Remember Legionella when you're reopening your workplaces, that bugs might be Legionella bugs, another pathogen sitting in your facility needs to be dealt with. Check on ventilation systems where they discharge, particularly if they discharge outdoors or in other locations where people may work. And remember ventilation engineers who come and change and clean filters or change and clean ventilation systems need special systems of work to protect them. So I'm going to finish on, that's all very scary, but where do I go for some help? So I put 3 lots of guidance up, and plus the work that Gert's going to share in a minute. So the guidance I produced with the OECD is free to download from that COVID-19 website. Actually, there's a mistake in that. There's no hyphen. We'll correct that when the slides go out. There's no hyphen between COVID and 19 in the website. I've just spotted that. The UK government has issued 6 sector-based guidelines on construction, offices, factories, labs, shops, working in other people's homes, restaurants, etc., etc. So they're free to download from that website, and you can get risk assessment templates that match those guidelines from writing to me at Ian Travers Limited, or go to that COVID-19 website. I will correct these slides before you get them, by the way. But if you're going to write down the address, there's no hyphen between COVID and 19. Okay, so that's, I'm sorry that was a bit quick, but that's me done. Over to you now, Gert. Do I have to give you back permission, or can you take it from me?
Yes, I shall give it to Geert again. Okay, thank you so much, Ian. That was really informative and I think helpful for a very broad audience.
Questions. I beg your pardon. Has anyone got any questions?
I didn't receive any questions in the chat box, but people, please do feel free to unmute your microphone if you do have a question at the moment, then you can pose it directly to Ian. Sorry, Ian.
Don't worry.
Okay, I don't see any questions, and I think it was a pretty clear story as well. So if there are any questions popping up, please post them in the chat box, then we can attend to them at the end of the webinar. So thanks a lot, Ian. Also very happy with all the documentation that you will provide afterwards to the attendees. And of course, to remind everyone, we will share the slides, so all the information that's in there, also the links to the documents will be provided to you. If there are no questions left, then I would like to invite Geert to kick off with his presentation.
Well, thank you, Elise. I do have a little question for Ian. I kept silent because I was going to get my turn anyway. But Ian, I really enjoyed your presentation. Thanks about that again. I already enjoyed the guidance, but this really was also quite helpful. I really liked the comment that you made. So it's not PPE, it is CPE, Community Protection Equipment.
Yeah.
Well done there. can you elaborate a little bit more on how this could be? Would this maybe be something new that we will be looking at? That this is actually going to be something as familiar to people in the future as PPE is nowadays, or was already?
Yes, I think so. I think so, and that's a big challenge because people normally wear PPE for personal protection, goggles, glasses, gloves, etc. And the concepts are well understood that it's a barrier. So things that come at you are, through the air or touching, you're given protection from. Whereas with COVID-19, that level of protection obviously has to be given in medical conditions and people who are caring with COVID-19, and they need to wear visors. Another high-risk occupation is dentists because of the aerosols created from people's mouths. But ordinarily in the workplace, social distancing is the thing. The face mask is not much of a protection. They're very badly worn normally. They give very poor filtration rates. People, likewise, in the shop the other day, the cashier took off her face mask to talk to me, and you think, well, there's not a lot of understanding what this face mask is doing if you're taking it off to talk to me. So I think there needs to be a behavioral change around society, especially as lots of governments now are saying, if you travel on public transport or if you go into confined spaces indoors to shops and things, you will wear a face mask, then 95% of people in there need to be wearing them and wearing them properly. And that I don't think has been communicated effectively in society and even in workplaces yet. So I think that's a lot of work still to do on that.
Excellent. I've seen that my question just going first has helped one person also ask a question in the chat box. Mr. Genip, if you would like to unmute yourself, you can maybe ask your question directly to Ian. Ian, thank you for answering my question. I might have another one following up after Mr. Genip.
Yeah, this is Mr. Genip.
Hi.
Good morning. So my question is, you were talking about keeping more distance in an office environment if you've been sitting there for some time. So I work in a big office building. It has central ventilation. There's no windows to be opened. So does it make any sense to put a time limit on people working in the office and saying, okay, after 2 hours you have to go out for half an hour or so?
No. Generally, the ventilation systems that we have in modern buildings, and I'm assuming yours is modern, are pretty good. They will have filters. It should not present any extra risk. The behavior change you need in offices is that people need to come to their workplace, sit down and work and not move about. Whereas when I was at work, I was always looking for an excuse to go and chat to somebody, go and have a coffee, etc., etc. That behavior now has to change. Okay, the least you move around the building,
no running around,
the least you move around, the safer everyone else and yourself will be. Yeah, and that's awful because I'm a terrible fidget, so I like to get up and move around. So I think the ventilation should be fine, but it is that come to work, get to your workplace, stay there. And obviously, if you need a break, then you need a break, but stay in your workplace in the one place as long as you can. And of course, 2 meters isn't 2 meters in an office where you've got lots of people, it's 4 meters. So 2 meters is between 2 people is fine, but then you've got 2 meters the other side of the 2 people and 2 meters that way as well. So you end up with 4 meters, which is a big space to remain safe. So workplace density in terms of where people sit, where they may congregate, like tea points and printers and whatever, is important to consider. That's why that workplace plan and flow to get right is essential.
Thank you.
Well,
Thank you for your question. I promised another follow-up question. Which is around your hierarchy of control. I think you mentioned your tiers in your presentation, and funnily enough, what I've seen in the past years is plenty of hierarchy of controls, and usually behavioral controls are deemed the least reliable, the weakest controls of them all. And for instance, if you would make a barrier social technical, for instance, like, or even active hardware, those are deemed much more reliable and much better barriers than the behavioral ones. However, in your presentation, it was quite clear that the ventilation was the weakest of them all when considering. Is that a correct assessment?
Yeah. I think, and obviously I've looked at CCPS guidelines, etc., on barrier protection, and we'd all love something physical and passive that's going to protect us, but doesn't exist other than staying at home. Okay, so we're straight into behavioral safety in this issue, and how people behave and understand the protection measures is the most important part of all of this. And that's why when you look at my guidelines, you'll see they're written in the basis of what does this protection do? Why is it necessary? Who should do it? Where should it be applied? Because it's not a universal thing that you can apply everywhere. You've got to mix and match those protection measures throughout your workplace.
Well, thank you. Thank you. All right. I see no other questions. Elise, am I supposed to move on now?
Yes, I think considering the time, you definitely should. So feel free to kick off.
All right. Let's see if this presentation will work. Okay. So thanks again, everybody. I'll be talking a little bit more about guidance and the tools that we have at CGE and how we can help implement that guidance in an organization. So I'll start very quickly with a little bow tie method introduction. I'm hoping that most of you are very familiar with it, but we always do a little bit of method before we talk about bow ties further. Then I will go into the COVID-19 return to work safely guidance bow tie that we created, and I will demonstrate some of the work we've done around that bow tie. For instance, we created an audit protocol, and well, actually Ian created an audit protocol around his guidance, but we managed to get it into our bow tie server solutions. And of course, there will be more room for questions and answers. So please feel free to put them in the chat box or keep them for the end of the session. A little bit on the bow tie methodology. You see here a very basic depiction of what a bow tie is. You see in the center, not the hazard, the square box, which is something that we want, but that has the potential to cause harm. And so we want to manage that. That's why we create a bow tie. Under there, you see the top event. That is the first moment that you lose control over that thing that you want, but that you can have harm with. The top event is the center knot. What leads to the top event are first the blue boxes. Those are called threats. These are things that in and by themselves can cause the top event. And on the other side, the right side, you have the consequences. And these are things that have or that contain harm. And those are absolutely the things that you want to avoid that happen to you. In between, it's the barriers. You have preventative barriers between threats and top events, and you have recovery barriers or mitigation barriers between consequences and top events. And the preventative barriers manage to, for instance, stop the threat from leading to the top event. And recovery barriers can maybe regain control over the hazard, or they can mitigate, for instance, the consequence. These barriers, they are all not as titanium and strong as you would like, and they have weaknesses. And in the bow tie method, we identify that by the escalation factors, the yellow boxes that you see under that. Each barrier has them. And when you have an escalation factor, that's something that can defeat the barrier from performing in the way you want it. And if that happens, you would like to maybe make sure that it doesn't happen, so that for you have escalation factor barriers. And in a nutshell, that's the bow tie method for you. That's what this is going to be about. So in the next part, I read the guidance, I think 4 weeks back, maybe less, when Ian and Brian Doyle were publishing this on LinkedIn. And when I read it, I thought, but this is all about the hazard, of course, that we are living in. And this is all about the scenarios of going back to work and the risk that's involved with that, and what are the controls that we have, and what are the kind of activities that you need to have. So I was reading all these things that I know very well from the bow tie method, and I thought I want to make a bow tie for this guidance. And very quickly, we managed to get in touch with Ian, who's a close partner of ours, and asked him whether he would like to work on this webinar with us, as well as help us develop a bow tie around his guidance. And what you see on the right side is the bow tie that we created from it. And I will actually now go into bow tie XP to show you very quickly that very specific bow tie. I'm closing my window because somebody's doing some construction in my neighborhood. This always happens. It's the charm of the time we live in. Can everybody see, well, Elise, can you say if you see my screen?
Yeah, I can see it.
All right, so this is bow tie XP. The bow tie starts, of course, with the hazard, increasing operations on site during COVID-19 pandemic. That's what we want now in this situation. This, of course, has the potential to go wrong. So potential infection with COVID-19 at work. This is something that we want to avoid at all costs. At the second level, we have 2 threats identified. The person-to-person transmission, that's something, and the indirect transmission from contact with contaminated surface or objects. Also, you might remember these 2 things from the presentation from Ian. Of course, the top event will lead to new spike or outbreak of COVID-19 virus, which we also absolutely want to avoid. At the third level, we have the barriers. I'm going to keep it simple for now to just have the barriers only. And the barriers, they're kind of basic if you think about it. There's not that many barriers, and in this presentation, he covered them. So working at home or remotely from others, keeping your distance, the most effective barrier. Social distancing, very effective, but still, well, hard to do, very, very hard to do. So this one has an escalation factor, 2 actually, and we have put some barriers in there that we could identify as well. Wear appropriate PPE, so the least of, also again, one that's very difficult, personal hygiene, workplace ventilation, and that's an active hardware, and workplace health checks, exclusion staff with symptoms or with V-test, same for members of the same household. So these are your barriers. They're not that many. So what I've seen a lot in the past with clients and potential clients is when they first make bow ties, they think that they need to be very large and they need to be very complex. But in the end, actually, the goal is to make something that is manageable and understandable. And that this depiction is quite simple and easy to understand for everybody. These are the barriers. These are the things we're going to have to deal with. These are the scenarios that we're going to try and manage. Of course, each of these barriers are quite hard and difficult to manage. There's a lot of things that are happening here. So we can capture them in activities. And that's how we did that here. So I'm going to show you what this looks like when we add the activities, as well as the type of barrier. So just to show you which were behavioral completely, which are continuous hardware, and which are social technical, for instance. But under there, you now see the activities. And these activities are the ones that we took from the guidance from Ian Travers's guidance. And we try to also point out whether it's the responsibility that to perform that activity for the organization, or if that activity responsibility lies, for instance, with the individual. Face masks, for instance, inspirational. Also, in each barrier, if you go into the barrier, there's also the guidance added to there in the description, and the connection is also in the software. So this was the first thing that we did quite quickly. We managed to create this bow tie and these activities because, well, the guidance really called for it, and it was quite easy to understand. But this, in a way, can actually reduce a full document into one picture. That's one of the nicer things that you can do with a bow tie. This bow tie that I'm showing you right now will be available to anyone who wants. So especially you who are joining this webinar today, you will be receiving this webinar via email. You will be receiving this bow tie via webinar. but you will also be receiving an invitation to our Bowtie server product, which I'm going to show you next, because we did more than just create a bowtie from the guidance. I have to go back to my presentation. I think this is the one. All right, so what did we do next? So, well, actually, what did Ian do next? Ian, from his COVID-19 return to work and occupational health guidance, he created an audit protocol in Excel. So that's what he did, and I got word from him that he did this, and he was kind enough to also actually share this protocol with us, so that we could actually try and put the whole protocol into our software and into a survey that you can actually run via Bowtie server. And so that's what we managed to do. Took some work. We finished last night, thanks to our team. So Elise here on the call, and Paul McCulloch, if he's maybe listening. Really well done, and it took quite some work. But so we recreated his COVID-19 protocol, audit protocol, into the software, and we managed to link all relevant information that were related to activities under the barriers that they're supposed to be with, as well as create overviews in a compliance framework for the questions in his audit protocol that were not barrier or bowtie specific. I would like to show you now in Bowtie server what we did there, and I'll do a very short demonstration. So if I'm in Bowtie server, so this is my landing page. You will find the bowtie here. By the way, why am I showing you this? Because you will all be getting an invitation to join this server. So this is a special COVID-19 bowtie server. The bowtie is in here, the bowtie that I just showed you. If you don't have Bowtie XP software, you can here then create, you can save the image with that little floppy disk there, for those who remember what a floppy disk is. This will download this picture and create for you an overview that you can actually look at. So I'm clicking it. So it will create this picture, and you can send this picture to anybody in your organization, and so that they can identify and read it. This is a vector file, so you can make it as big as a poster easily, and it's still readable. That's the first part that we did. So that was the easy part. In Wiki, we also actually loaded Ian Travers's full audit protocol. So sorry, the guidance. So it's all in there. So if you can go to his website and download the PDF, but the guidance is also in here. So you can read, you can go through it, go to the next page. And what is interesting here is that each section of the guidance is also connected to the bowtie. So here's the bowtie. If I go, for instance, to the barrier of social distancing, and I open it, so of course there's the description. There's also the link, and I can go directly to the part of the guidance that is actually related to that section. You see? So a section is then related to social distancing, and I can quite quickly go back to that. Last but not least, of course, so we had this audit protocol from Ian Travers with risk assessments and drop downs, etc. We managed to get that into the Bowtie server. So I was actually in the process of finishing doing mine. So I was doing this one today. I'm almost done, and you can see each question is in here, and there's also which barriers and what scenario it's related to. I can attach evidence if I want. I can put remarks, and I can say met, partially met, or not met. If I leave it blank, it will not show or be counted into the overview at the end. Okay, so I can either continue this audit right now, but I think that would be a little bit of a waste of your time. So I'm going to say I completed it. It's going to warn me that I have 73 questions left, so I don't want to complete it. But in the meantime, I can look at it on my bowtie. So it's connected to a bowtie, And here I see my current answer status on the bow tie that we've created. So the little lines under here are the questions related to the activities and how I'm performing on that. So if it's green, then I probably said it's met. If it's half red, it means that it was partially met. And if it's fully red, then it means that I was not met. There's also the compliance framework. So here you have also all the questions that I was not able, well, all the questions that I was able to put on the bow tie, but also those questions that I was not able to put on a bow tie, like these, the risk assessment part. These were separate questions that I wanted to put on in there, but I couldn't link them to a barrier, for instance. So this is how we managed to do that. Of course, total avoidance, health and surveillance, these are all nicely linked to barriers. And you can go on into there. So let's go and see physical distancing. And if I go in there, I can see I could change my maturity level, for instance, here, and you see how I'm doing. So apparently I'm not doing very well on social distancing. Some things are okay, but some are only partially implemented. And this one, have you minimized non-essential travel by considering remote options first? Well, that one is apparently a no-no for me. So why am I showing you all this? Well, this is because you will get an invitation to this, and you will get your own local bow tie. By the way, you will be invited to join this bow tie server completely anonymous. So when you sign on, you will get a number. So please don't get the wrong idea. It's just to keep it anonymous for you. If you want, you can then later contact us and say, yeah, please put me in under my real name and my company name. But you can perform the audit for your own organization and see the results on how you're standing in front of it. Of course, it's a great first step, but it will maybe also pose a lot of follow-up questions. For that, of course, Ian Travers and his team and other partners will be ready for you. So there will be contact information in there. If you want, they can review your audit and maybe give you some guidance, further guidance on how to proceed or how to tackle certain of your weaknesses if you want. But in the start, you can see and follow if you thought of all the steps that you're supposed to follow before you go back to work safely. I'm going to go back to my presentation. I think I'm almost done. Yeah, I'm done. So thank you again for your kind attention.
Thank you so much, Gert. That was really useful. I think it's a very practical application of Ian's guideline. So thanks for that information. I don't see any questions on the chat for now. I do have a question sort of as a recap. So if I understood correctly, our attendees will be provided with this bow tie. They will receive an invitation to also join the bow tie server, and they will be able to do that work themselves. So to fill out an audit and plot those visual results on their bow tie to see how their organization is doing. Am I right?
Yes, it's even simpler than that. They will get an email from bow tie server with their login name and their password, which is random. And in there, they will see a bow tie, the COVID bow tie with the activities and the guidance on it. They will see the guidance as well in the wiki. And they will see in their actions or in their surveys on the landing page that there's a survey assigned to them. And they can choose or not choose to do that survey. If they do the survey at any time, they can look at the status on their bow tie. And at the end of the survey, they can request to get a report from Ian or from another partner in there to see whether how they have done. But they can also look at the status of how they answered the questions and on the bow tie themselves in the server.
Okay, that sounds cool. That sounds great. I got a question. Do we get the email today? I think today or tomorrow. So expect it tomorrow. And if it's today, then of course, that's an advantage. But expect it tomorrow so we can have the whole thing up and running without any errors. So that's to be expected.
So It's running, it's up, but we're still testing privacy issues.
Yes, and that's important. So we want to make sure that that's okay before we send the invitations out. Okay, great. And what do people have to pay for this?
Well, that's the good part of this. Everything that I've showed you now was free and is free.
That's cool.
So yeah.
And
so thank you, Ian Travers, for doing all this work and sharing it with the audience and with our audience and through our platform. And thanks CGE, of course, and my team that managed to do all this work. So it took quite some work to get it all in there. It was fun to do, but yeah, the idea is that this will help you and use the tool in a very useful way. For most of our clients, maybe a new way. AuditXP is not the most used feature that we have to offer. Of course, BowTieXP everybody's familiar with, but AuditXP and how powerful that can be for an internal inspection, yeah, that is quite nice. So this is a good opportunity to and a free opportunity to test out this kind of functionality.
yes, that's great. Let's round it up.
I just add my big thanks to you guys. You've obviously worked very hard on turning my guidelines into this marvelous tool, and that's the first time I've seen it, and it just looks fantastic. So thank you very much. I think this is going to be such a valuable resource for quite some time to come. This isn't over yet. It's not over by a long way, and we need to stay focused on this. So my thanks to everyone at CG Risk for doing all of that.
It was our pleasure as well, Ian. Thank you so much. I still received a question from Ruben. He asks, is it possible to quantify the events on the workplace? The Bowtie method is not per se meant to quantify results. So it's really a qualitative tool. So what Geert has shown you, it's really to visualize how you're doing. So for now, we don't have any quantifications add to the Bowtie itself. Maybe, am I being complete, Geert?
Sure, yeah, absolutely. There are ways to quantify a Bowtie. So Ruben, if you're looking for a way to do that, you have to look into our features that are called LOPA. You feel free to ask further questions around that. So LOPA would be a way to quantify this Bowtie, but we don't have any of the quantification assumptions to put on there right now. What is going to be interesting is that the anonymous, if everybody here will be filling out the survey, we will have quantified numbers and ratios on each of those barriers, how easily that barrier is being managed. So now we can say it's not effective or it is effective, but that's more like a personal experience assumption. Now we can see how it actually is going to be in practice compared to multiple people, multiple organizations and multiple sites, how they experience this and whether it is possible to improve on that or that these barriers degrade. That's actually a part that is going to be able to be done in the server.
Yeah.
So maybe last part is that there's going to be the option also to look at the global Bowtie where all answers, all anonymous answers will be published so that you can actually compare your own numbers to other organizations' numbers.
Okay, so they will be aggregated. So maybe
Yes.
that's a next step in the future. Of course, we live, we learn. We don't understand COVID exactly. So once these data and figures are available, of course, that's a possible next step to take in a LOPA plugin, for instance, on a Bowtie. Thank you, Ruben.
Add one final point, if I may. Please, if you've enjoyed this webinar, let other people know there's another one later today. We could rerun it if need be. Share the word amongst people that this guidance is available, because it's a very lonely place to be out there on your own wondering what to do, and this help is, I think, there for everyone. So pass on the word to your colleagues and people you encounter, and please share this resource as widely as you can, because we're all in this together. We all have to get through this the best way we can. And this is, I think, the reason I wrote the guidance and done the risk assessments is to help people through this. So please do share the word and pass this on.
Thanks,
Absolutely.
Ian.
Thank you,
That was
Ian.
so helpful.
Also, it's being recorded. So if you want to, so also our marketing team will be sending you an email thanking you with the presentations. And in that email, there will also be a link where you can request to get the movie of this webinar. And you can maybe even choose to get the movie of this afternoon's webinar if you're missing that. But so that's also going to be one of the options. And please indeed spread the word, let people know. So for now, we have only those people who wanted to register for this webinar to add to the server that we created for people. It is anybody is allowed to join. So feel free to spread the word and have people get online, get in there. If you run into questions, if you're thinking, okay, but I need this more specific and I need more. Yes, indeed, this is really just the tip of the iceberg that we're showing what is possible. So please do not hesitate to contact Ian with any questions that you have, or contact ourselves, myself, my contact details, and those of Ian and of the Has Risk Solutions Group. Our other partner, Brian Doyle, is also in this presentation. If you have questions or want more specific or need help, it is available. It's at your fingertips. You just need to ask.
Okay, thank you so much. Considering the time, I'd say we round up. So you're gonna get the presentations, the webinar itself. Reach out, please, to us if you have questions. Thank you so much for your attention and your relevant questions. I would like to wish you a very good day, and of course, stay safe. Thank you.
Thanks, Ian. Bye.
Thanks, guys.
Thank you, everybody. Bye-bye.